Giving the wrong amount of medicine to a child is one of the most common medication mistakes. A small dosing error can affect how well the medicine works, or even be harmful. In this video, you'll learn how to measure children's syrup safely and accurately. Children need the correct medicine dose based on their age or weight. Measuring accurately is essential. Always read the medicine label and check the prescribed dose. Make sure the medicine belongs to the correct child. Never use expired medicine. Many liquid medicines should be shaken well before use. Always use the oral syringe or measuring cup that comes with the medicine. Kitchen spoons are inaccurate and should never be used for medicine. Measure the medicine at eye level for accuracy. Draw the exact amount into the oral syringe. Place the syringe inside the child's cheek and give the medicine slowly. Keep your child sitting upright while taking medicine. Do not mix medicine with food or drinks unless instructed. Offer praise after taking the medicine, but don't call medicine candy. Wash the syringe or measuring cup after every use. Store medicine according to the label and keep it out of children's reach. If you miss a dose, follow your healthcare provider's instructions. Never double the next dose. Never give extra medicine because your child seems very sick. If you're unsure about the dose, ask your pharmacist. Avoid kitchen spoons, guessing doses, expired medicine, and incorrect measuring tools. Measuring children's syrup correctly helps keep your child safe and ensures the medicine works as intended. Follow PharmaWise for more trusted medicine safety tips.